Support for Seattle Now comes from Lazarus Naturals CBD. Since 2014, maker of non-GMO, hemp-derived CBD products. From the farm to the front door, all of their products are made in the Northwest and crafted in-house, allowing for end-to-end control. They offer a full line of topicals, tinctures, and pet products at LazarusNaturals.com.
Hey, it's Patricia Murphy. It's Tuesday, and this is Seattle Now. We are in a dangerous third wave of the coronavirus. 100,000 new cases each day nationwide. The freshly elected Biden-Harris administration says tackling the pandemic is its top priority. But personal responsibility is a big part of that. And there's a lot of conflicting advice about how to stay safe and minimize COVID risk. In a minute, Marissa Baker, an expert in occupational and public health at the University of Washington, will tell us how to stay healthy through the pandemic. But first, let's get you caught up. Two King County sheriff's deputies were injured yesterday in a shootout with a suspect in Woodinville. A sheriff's spokesperson says the suspect fired at deputies and was shot and killed. Law enforcement were dispatched to the Woodinville apartment complex after reports of someone possibly prowling vehicles. Both deputies were briefly hospitalized but have since been released. Alaska Airlines will soon have a new CEO. The Seattle-based airline announced yesterday that Brad Tilden will step down at the end of March. He's been leading the company for the last 8 years. His successor, Ben Minicucci, is currently Alaska Airlines president and a board member. Alaska Air has been hit hard by the pandemic, reporting a quarterly loss of $431 million. And hello, Mariners fans. Outfielder Kyle Lewis was named American League Rookie of the Year by the Baseball Writers Association of America. 25-year-old Lewis is the fourth Mariners player to win AL Rookie of the Year, the first since Ichiro Suzuki did it in 2001. Coronavirus cases are surging in the U.S. New daily cases are up nearly 60% since 2 weeks ago. And Seattle, we're in a hotspot. King County has amassed over 30,000 confirmed cases since the start of the pandemic. Right now, we're seeing 450 new COVID infections a day. And as we tackle this rising tide, it can be confusing to figure out what's safe behavior, particularly for those of us who can't work from home. Marissa Baker is an assistant professor in the School of Public Health at the University of Washington. She's here to help us safely navigate this third wave of COVID. Thanks so much for taking the time, Marissa.
Yes, thanks for having me.
So what's behind the spike in numbers we're seeing this winter?
So I think it's two things, really. One is, we're in month 8 or 9 of this now. And so we're starting to hit a little bit of pandemic fatigue. We miss going to restaurants. We miss going to see movies. We miss seeing friends and family. In general, people are kind of starting to relax a little bit on some of the best practices. The other large contributing factor is as the weather cools, as we stare at our 6 months of rain and darkness starting at 4 p.m., people just have to move inside more. And we know that that's a spot where this virus likes to spread. So if we can't eat outside, we can't do social activities outside, we're going to see that rise in cases.
Marissa, we get a lot of advice about how to keep from becoming infected with COVID. We wash our hands, keep 6 feet apart from each other, wear a mask. How has the public health advice changed since we've learned more about coronavirus transmission?
Yeah, so I think the great news is we do know a lot more about this virus. And so we really do have better advice for how to keep people safe. Early in the pandemic, there was a big emphasis on washing your hands, washing hard surfaces that you might touch. And while, of course, general hygiene is important, now we really understand that it's the airborne route of exposure that we should be concerned about. Anything inside is going to be less safe than something outside. But that being said, so you need to think about some of the other variables. So if you're inside, you need to limit the number of people. You need to limit the number of time. You need to keep your mask on if at all possible. Keep space. And we've heard 6 feet repeatedly. But a lot of evidence is starting to show that 6 feet probably isn't enough for some of these smaller particles. So while 6 feet is good, 10 feet is better, and any more than that is better still. limiting aerosol generating activities like singing and laughing. I mean, sounds like a lot of fun, I realize, but
weeping generates an aerosol too, Marissa.
True. So anything you can do to kind of limit the number of people, anytime you can create some airflow, whether you're opening the windows in your house if you can, the idea of kind of purging the space before people come. So if you know you're having people over, even if you're not supposed to, open all the windows and kind of purge the space. And then after they leave, do the same thing. And that's kind of a way to help clear out any aerosols that might remain.
Marissa, we are all dealing with these decisions that we have to make every single day. I'm going to lay a couple of them on you that I've had to make in the past couple of weeks, and maybe you can give me your advice. My 14-year-old would like to have a sleepover at one friend's house with one friend.
I think that this is a situation that if both of the families are on board with how the other family has been handling the pandemic, can both families say that we've been limiting our interactions, we've been wearing our masks, and if both sets of families are on the same page of I've really been limiting contact, then, this would be a scenario that I would think would be okay.
I have to send my preschooler into the classroom.
Yeah, so this is a situation I'm in. I have a preschooler who is in the classroom as well. You're at the whim of everybody else that your child is interacting with, and it's completely artificial to think that preschoolers can social distance or correctly wear a mask for an entire day, if at all. The things that I look for that make me feel more comfortable with a preschool setting is, are they spending as much time outside as possible, even during rainy times? Are they able to keep the windows and or doors open to create that airflow? Are they limiting adults who are coming in and out of the facility? There are ways to keep kiddos safe, but preschools are already so excellent at getting kids to wash their hands and frequently, which is so impressive, like wash your hands right when you get there, right before you go outside, before you eat, after you eat. They've already been doing a lot of the hygiene steps for cleaning the classroom. So if your child is in preschool, I don't think you should feel guilty. If you're choosing to keep your child home from preschool, you should also feel comfortable with that choice as well.
Okay. One thing you would absolutely not do during this time that you could.
Yeah, so I would not eat inside at a restaurant. We certainly still need to support our restaurants through takeout, as long as you're wearing a mask when you go to do so. But I am not yet at the place where I feel comfortable sitting inside a restaurant. It's a lot of people without masks, in groups, talking and laughing for extended periods of time. And so for me, that just ticks too many risk boxes.
Okay. What if you can't stay home, though? What if you have to take the bus to go to work every single day? These are decisions that families are making all the time right now. What is your advice for people who do not have the luxury of working from home?
Yeah, so certainly being able to work from home is the ultimate privilege during a pandemic. And research that I did earlier in the coronavirus pandemic shows that only about 25% of U.S. workers are actually able to work from home. So if you're riding a bus, you're going to want to keep your mask on, of course. And we're starting to see that those blue 3-ply surgical masks are actually probably the best bet for most people, better so than a cloth mask.
So the disposable ones.
Yeah, those disposable ones, but also sitting near an open window on the bus. Again, creating that airflow is going to be better. If someone comes and sits down close to you and you can move, do so. Move to create space. And the fact that the bus is opening and closing the door is actually a good thing because you're getting air movement through the bus.
The holidays are coming up when, of course, we all want to get together with family and friends, but we're also dealing with this deep fatigue. How do we balance the risks attached to isolation and our need to get together with each other?
The broadest, highest level of advice is don't travel for Thanksgiving. Don't travel for December holidays if you can at all avoid it. The challenge is when you're in at a Thanksgiving table, you can't be wearing a mask. You're sitting close to people. You're going to be talking. Hopefully you're going to be laughing. Those are events where infection transmission could occur. This is a particularly crazy year for Thanksgiving. There's a lot of very hot topic things that are on people's minds. And I say, if that is going to stress you out more than it's going to give you enjoyment, don't do it. Just say you can't go. Just say you don't want to go. But if you do feel like everyone's on the same page as you, I think it's just important to set those expectations early. Like, I'm not going to spend the night, or I will only feel comfortable eating if we sit one every other person at the table, or as soon as the meal's over, I'm going to put on my mask and open a window. Let's all agree that for the 2 weeks, which, that's starting soon, the 2 weeks before, we're going to be very diligent about staying home, monitoring your symptoms. Maybe don't have anybody else over to your house. Be diligent about wearing a mask. And then the same kind of things apply after Thanksgiving. So what I'm concerned about is people will go to Thanksgiving with their groups of family on Thursday. Monday rolls around. They're like, I feel fine. I'm going back to work. But unfortunately, for the course of this disease, probably by Monday, if you are a symptomatic carrier, you wouldn't be having symptoms anyway. So it's kind of mid of the following week where people might start to feel symptoms. So if you can, monitor yourself even after Thanksgiving for a while and take yourself kind of out of society if at all possible. To the extent you can set those expectations early. And if the expectations don't align with what will make you feel comfortable, then you don't have to do it. And here I am giving you permission to skip Thanksgiving if you think it's going to stress you out.
Absolutely. And King County Public Health Officer Dr. Jeff Duchin has advised the same. His words and his warning were very clear. Don't gather this Thanksgiving so we can all gather next Thanksgiving. Marissa Baker is an assistant professor in the School of Public Health at the University of Washington. Thank you so much for your time and your expertise.
Yeah, it's been great.
Thanks for listening to Seattle Now. The show is produced by Sophie Reed, Clare McGrane, Matt Martin, Caroline Chamberlain-Gomez, Andy Hurst, and Jason Pagano. Matt Jorgensen does our music. I'm Patricia Murphy. See you tomorrow.
Hey there, it's Dyer Oxley. I'm a web producer here at KUOW, here to tell you about our new daily newsletter, Today So Far. You see, every morning, we're going to break down the most important local news stories of the day, so far, and deliver it straight into your inbox. Today So Far will be KUOW's insight on the fast-moving news of the day. Be sure to get it in your inbox by Monday by subscribing for free at KUOW.org/newsletter.